what is the best treatment for fertility in couples who are more than 40 years of age. Now, there is no best treatment as such, but we have to consider the effect of age in both men and women, what it causes. So let us start with the women. As the women's age increase, especially beyond 35, their egg number and egg quality decreases significantly, which reduces your natural fertility as well as your chances with fertility treatment, including IVF and IUI. So it is important, if you are above 40 years of age, you should get yourself evaluated from a fertility specialist to understand what is your current egg reserve, what are other conditions which can affect your fertility, and what are your chances when you're trying naturally or with IUI and IVF. So it has to be an individualized treatment, and there is no single treatment which is best. But what we can tell patient is, when you are already having lower side egg reserve and you are planning a pregnancy, it's better to consider fertility treatments earlier. Because for fertility treatments also, we need the number of eggs which are good quality. So if you are planning pregnancy after 40, it's important that you move on to fertility treatment, especially like IVF, earlier, so that you can conceive with your own eggs. Also, it is important the effect of age on the egg quality, which means that the quality of the embryo which is getting formed, and also the risk of miscarriages which is related to the genetic abnormalities in the baby, which increases with higher age. So in IVF, we have genetic testing of embryos which is available, which is known as PGTA, pre-implantation genetic testing for aneuploidies, so that in couples, especially women, if they are above 40 years, if we are having enough number of good quality embryos, we can do embryo biopsy to know the genetics of the baby. If it is a euploid embryo, which means having a normal number of chromosomes, then we select that particular embryo for transfer, hence increasing the chances of implantation in a woman above 40 years, and also reducing the risk of miscarriage and genetic diseases in the baby. But the problem here is, if the age of the woman is above 42 years, almost 80% embryos are genetically abnormal. So if you are beyond 40, you should move on to the fertility treatment earlier. You can consider all the options which are available, understanding the success rate of each one. If you're going for an IVF, there is always an option of IVF with PGTA if you have good quality embryos, so that we can reduce your miscarriage risk and increase your chances of implantation and a genetically normal baby. Now coming to the men's age above 40 years. Does it affect fertility? It definitely does affect, because when your age is above 40 years, most of the patients, they have some or the other metabolic problem or other health conditions like thyroid, diabetes, hypertension, high cholesterol, deranged liver function test, and all of these can affect your egg and sperm quality both. Especially in men having diabetes and high cholesterol level, or having history of heart disease, such patients tend to have higher DNA fragmentation index of the sperms, which means that the DNA of the sperms is fragmented, which leads to poor quality embryo even in IVF, and also to the increased risk of miscarriages and schizophrenia and autism in children. So this needs to be addressed in time. If you are above 40 years, it is important that you do lifestyle modifications, keep your other health conditions under control, stop smoking and having alcohol, which can also affect the sperm quality. Get yourself evaluated from a fertility specialist for a semen analysis and also DNA fragmentation index. Based on your report, the fertility specialist can advise about the sperm selection techniques to use in IVF, so we can increase your chances of getting a better quality embryo and increase your chances of conceiving with your own eggs and sperms. So this was about the couple above 40 years who are trying to conceive. It is important that you visit a fertility specialist, get yourself evaluated as a couple, understand your chances, treat all the medical conditions, and there are different protocols which we use for women above 40 years based on your egg reserve and your follicle numbers. So we try to improve your chances of conceiving with your own gametes. I hope this was helpful. Thank you.